Hello. If you have kidney stones, I want you to watch this video carefully because I'll be discussing 5 major mistakes people who have kidney stones usually make that actually lingers their passage of kidney stones. All right, it's not enough to just know that you have kidney stone. It's also very important to avoid these 5 costly mistakes. One of the mistakes that people make is that once they start having lower back pain, they conclude that what they are having is kidney stone and they start treating kidney stone immediately. That you have lower back pain does not mean that you have kidney stones. All right, because we have a lot of other medical conditions that can actually cause you to have lower back pain. If you're a woman, having ovarian cysts or having issues with your ovary would actually mean cause you to have lower back pain. All right, having PID, pelvic inflammatory disease, could also cause you to have what we call lower back pain. Okay, so apart from that, you may also experience lower back pain if you're a man above 40 to 45 years of age and you have enlarged prostate or early signals of prostate cancer. You may actually start having this lower back pain. So it doesn't mean that every lower back pain that you have is actually associated with what I've just said. All right. So now, if you have kidney stones, you will also experience this lower back pain. Apart from kidney stones, when you have any issue with your kidney, it will also signal you that you have issue with your kidneys by causing some pains, lower back pain for you. So it could be kidney cyst, it could be kidney infection, it could be kidney stone, it could be hydronephrosis, it could be, I can go on and mention kidney related issues that could actually give off as lower back pain. So you don't just conclude that because you're having lower back pain, that what you're having is kidney stones. All right. So you need and you start treatment, because if you start treatment with the way you are going without being properly diagnosed, without diagnosis, you can actually put yourself in more danger than what you have actually envisaged. The number two thing that people mistakes that people do is that they think that drinking water alone is actually a solution for kidney stones. No, drinking water alone is not a solution for kidney stone. If you are treating kidney stone, drinking water is one of the many things that you can actually do. The second important thing that you need to do if you have kidney stone, apart from drinking water, is to make sure you are taking your medications very, very well. Yes, the place of medication is actually very, very important. So you don't, even if you're trying to do home remedy, it's important you discuss with your doctor on how your medications can actually come into it. So just drinking water without medication could actually be an issue. There is this trend that is going on in this era that people want to shun away from anything orthodox drug. That you're turning away from orthodox drug, are you holding something that is very factual, something that is scientifically proven, something that has actually worked for people? All right. So if what you're holding is something that is reasonable, you can hold on to it and continue with your water. All right. So note this, that it's actually your own personal decision. But if passage of kidney stone must be done within record time, I usually recommend between 8 to 12 weeks if you're treating kidney stones with every other means. If it doesn't flush out within 8 to 12 weeks, you need to try other means of treatment. All right. So the reason why kidney stone will not even cause you a lot of trouble, all right, it won't cause you a lot of trouble. It won't lead to kidney failure. But the reason why it can actually lead to severe kidney damage is when you do wrong treatment and this kidney stone lingers and causes a lot of complications for you. The third mistake that a lot of people make is that they don't know when to go for surgery. They don't know when surgery is the best alternative. I tell people, if you have kidney stone, it is actually very important that you don't manage it alone. I'm Onovo Victory and I'm your kidney health coach. I've helped a lot of people in the past few years to be able to guide them on how to treat kidney stones. One of the things I tell people in my section is that I encourage them that whatever your doctor tells you to do is actually telling you not from the place of they want to make money, but from the place of knowledge and for the base of and also a place of compassion. All right. So there's a point where you know that you actually need to do kidney stone surgery. So one of the things is that when the person have what we call stagnant stones, so stagnant stones could actually be a factor. Then number two could also be the position of the stone, and the size of the stone. So these things are the things that you also need to put into cognizance. Okay, so another thing is that some people feel that using only lemon can actually help them eradicate kidney stones. Where lemon actually works for a lot of persons, it's not a guarantee that it will also work for you. All right, so if you're here and your plan is to always use lemon for kidney stones, I want you to actually start thinking ahead. If this lemon I'm taking doesn't work, what is the next line of action? These are the things that you also need to take into cognizance. Then the last but not the least is that so many people who have kidney stone have resorted into taking painkillers, thinking that painkillers will actually end the kidney stone that you're having. What painkillers does is that it soothes the pain. It causes this pain to stop temporarily. But if the cause of that lower back pain is still there, it means that this pain will usually come back again and again. So if you abuse painkillers, you also bet with me that painkillers are among the top causes of kidney failure in the world. So if you're abusing painkillers, if you keep taking painkillers because of kidney stone, you're actually putting your kidneys into danger, and it may not actually all go well. So that is why when those in my class, there's a pattern we use in handling kidney stones. And if you want me to actually share this pattern with you, you could do well to become a member of Kidney Health class by sending me a message privately so we can actually add you to our closed WhatsApp group. I'm Onovo Victory, I'm your kidney health coach. Please do well to share this video to your friends and your loved ones. Thank you.